Okay, for this session, let's cover medications. And mostly in the eye clinic, medications equals drops. We do a few pills, but it's mostly drops. One big class of those medications are drops that we use to decrease intraocular pressure. Now, we decrease intraocular pressure by either improving the flow of fluid out of the eye or by reducing the amount of fluid produced within the eye. In the vast majority of times, the reduction in eye pressure is by reducing fluid production. So there's a few different ways we can go at that. One of the earliest medications and a basic medication is a beta blocker. Now, beta blockers decrease fluid production, and typically they're supplied with a yellow cap to them. And that's pretty important to remember. Many of these medications will be coded by their cap color. And so if you know the cap color, a lot of times you can guess what the patient is taking, because many times they forget the medication. So if it is a yellow cap color, then it is a beta blocker, and overwhelmingly these days it is a medicine called timolol. Timolol is administered twice a day, and again, the frequency is really good to remember because you can guess how often this medication should be used. Talking about all medications, beta blockers, and all other medications, when one instills an eye drop, you always instruct the patient to keep their eye closed for a minute and wait 5 minutes in between drops. That ensures the best effect of the drop. Another medication that can be used to decrease intraocular pressure are medicines called alpha agonists. Alpha agonists carry a purple top to them, and the most common one these days is called bromonidine. Bromonidine used to be called Alphagan, and you'll still see it occasionally as that. That's the trade name, but bromonidine is the generic, and we overwhelmingly see generic medications these days. Alpha agonists are dispensed or are administered 3 times a day, and they can come in several strengths, but the strength really doesn't matter. When they're used by themselves, they're 3 times a day, and we'll discuss some exceptions to this in a little bit. The next class of medication, and again, classes of medications are important because sometimes you want to increase the amount of drug effect, and you can use that by adding together different medications of different classes. The next one's called carbonic anhydrase inhibitors, and the drops for those come in with an orange cap to them. Again, the orange cap drops are administered 3 times a day, and the ones that you see most often are called dorzolamide or brinzolamide. Now, an interesting thing about the carbonic anhydrase inhibitors is that you can also get them in pill form, and that's called acetazolamide or Diamox. Those come in 2 different flavors. Acetazolamide can be had as a little white pill, and that's typically given 1 or 2 pills every 6 hours. Or you can get an extended release version called a sequel, S-E-Q-U-E-L, and that's administered twice a day, every 12 hours. Sometimes the pills are useful if the eye pressure is very high. If the eye pressure is high, I feel the drop doesn't get in as well, and that applies to all different kinds of drops. So giving a pill sometimes will give you a jump start. The pills have a fair amount of side effects. They give you tingling around the mouth and sometimes on your fingertips, sometimes make you feel a little tired. So we don't prefer that medication, but sometimes we need to use it. Another very popular class of medication are prostaglandin analogs. They are used once a day, and there's a whole group of them called latanoprost or travoprost, getting the gist here, or bimatoprost, and the trade names would be, again, Zalatan, Travatan, Lumigan, and another one called Vyzulta. The Vyzulta is the newest of them. All of these are administered once a day, and you get a better effect if you take it at nighttime. The prostaglandin analogs are popular because they're a once-a-day drug. They do have some side effects. They tend to make the eyes a little bit red, and they'll make your eyelashes grow and sometimes make the area around your eyes look red and beefy. The last of the intraocular pressure lowering classes are Rho kinase inhibitors. And the most common one that we see is one called Rhopressa. Now, Rhopressa is another class, can be very effective, but we typically use it as last line. It's very expensive, and it is the king of making your eye red. Like, it makes it so red that people think there's something wrong. There's also one that combines then this Rho kinase inhibitor with a prostaglandin, and it's called Rocklatan. Now, this is a little bit of a segue into the combination medicines, and there are two other combination medicines that you need to remember because they're very popular. And one is called Cosupt. That was the brand name, but most often you see this as dorzolamide and timolol together. So whenever you see dorzolamide, you want to always look and see, is it dorzolamide by itself or is it dorzolamide timolol? And the way that you can tell it apart, or that the patient will tell you that they're taking the combination, is dorzolamide timolol has a blue cap to it rather than an orange cap. Now, the blue cap drop, the dorzolamide timolol, is administered twice a day because it has the beta blocker in it. Another combination medicine is brimonidine timolol, that used to be called Combigan. And again, this is a very popular combination. Confusingly, it also has a blue top to it, and it is also administered twice a day. So these are very common. There is a third combination of these, which is the one that's left over, the carbonic anhydrase inhibitor and alpha agonist, and that's called Simbrinza. It tends to have this kind of funny green cap to it, and it is a 3 times a day drug. These are really useful to remember, and I think there's really no substitute to making a flashcard and just memorizing them. That really is the extent of the intraocular pressure lowering medications. We have another group that we use very frequently, and they're anti-inflammatory drugs, and that they break down into a couple of different classes. One that we use commonly are steroids. And the most common steroid we use is one called prednisolone. Prednisolone is typically supplied with a pink top. The frequency varies a lot depending on how potent we want the medication to be. So there's no hard and fast rule on how often we use it, like is with the intraocular pressure lowering medications. Another steroid that we use frequently is one called Durezol, or difluprednate. Difluprednate is much stronger than prednisolone, and we'll use it when we want that extra kick. Another steroid that you will see is one called lodiprednol, and the trade name was called Lodamax. All these will have pink tops to them, and again, the frequency at which we use them varies widely, and so you really have to query the patient on how often we're using them. Another class of anti-inflammatory medicines are non-steroidal anti-inflammatory medicines, a little like an ibuprofen for the eye. Now, there's a whole bunch of these, and we only use one of them. I feel that only one is effective, and it's called Bromfenac, and its trade name is Prolensa. We'll see that in a couple of different forms. It is available in several different strengths, but I think all of the different strengths are approximately equal in their efficacy. So especially when you're prescribing these medications, you can give them any drop, any strength that you want, as long as it's the cheapest one, and it'll vary wildly. Another class of medications that we use, and we use relatively frequently, especially after surgery, are topical antibiotic drops. There are a bunch of them. We only use one class, and we really only use one of them, and that's called ofloxacin. Ofloxacin typically comes with a beige top to it, and in most instances we're using it 4 times a day, and you will see it overwhelmingly in a post-surgical drop regimen. You'll see other versions of ofloxacin, the fluoroquinolones, but we just use ofloxacin. And that's a segue to the surgical kits. When we do surgery, we tend to give patients drops after surgery, and we'll give them a combination of a steroid and an antibiotic. And initially, they tend to be given 4 times a day. So it would be very common to see someone get prednisolone acetate and ofloxacin, each one of those 4 times a day. You'll see that very, very commonly. Those are most of the medicated drops that you'll see. We talk a lot about dry ocular surfaces, ocular surface disease, and recommend people use a lot of artificial tear preparations. And if you go to the grocery store, you see there's a whole host of different ones. They're not all the same. They have very different qualities to them. Currently, I prefer a couple of different kinds. Refresh is an kind of umbrella name for a bunch of different drops. Refresh has a Relieva product. I think that's very good. You can get it as a preservative-free drop in a bottle, which is a little bit unique and very nice. Systane is also a very common eye drop, artificial tear eye drop, and their Ultra product and their hydration product I feel is very good. So you'll hear us talk about those a lot, and if a patient is asking for a recommendation on artificial tears, those are very common ones. Sometimes you'll hear folks talk about, oh, are they safe to take? And the problems with recalls and contamination has always seemed to have been on the kind of fringy brands, and the good quality name brands seem to be much safer, and we recommend them highly. Another thing that you see in our clinic a lot are medications, but they're medications that we administer, injectable medicines within the eye. The treatments for a lot of retinal diseases now are injectable medicines that we administer for macular degeneration, for retinal vascular disease, and for diabetic retinopathy. And one of the biggest ones we will use are medications that are antibodies or inhibitors of a molecule called vascular endothelial growth factor. It's called VEGF. You'll see that a lot, VEGF. And there are a whole group of these medications. We use virtually all of them, and they are very interesting and very useful to us. They really, for us, have 2 different activities. They will decrease the growth of blood vessels, and in cases where you have decreased blood flow, that's quite important, or they will decrease fluid leakage from damaged blood vessels, and for situations where you have swelling in the retina, then again, this is very useful. There are a group of them. The first one that you'll encounter, and you'll encounter most of the time, is one called Avastin, or and we use Avastin predominantly. It is by far the cheapest of all the medications. And it is our frontline drug, and the vast majority of our patients, it works just fine. Another one that we use is one called Lucentis, called ranibizumab. You'll see it, but most of the time you see it Lucentis. It is a brand name drug. We get it in 2 different strengths. We get it in 0.3, which is used for diabetic patients, or 0.5 milligrams in a package. And that's used for vein occlusions or macular degeneration. Another one is called Eylea or aflibercept. That comes in 2 different versions. We really only use one of them. We use the standard one. There is a version where there's more medication in a syringe called the high strength or Eylea HD. We don't use it very much. I don't think it makes that much difference in terms of efficacy, and it is much more expensive. Another medication that we use is one called Vabysmo, which is a VEGF and an additional activity combined into one. We will vary between the medications to determine which one is the most effective for a given patient. So it's not a one-size-fits-all thing. We will try everybody on Avastin, and if that doesn't work, we'll generally stair-step our way through these medications until we find the one that works best for people. Now, which medicines we go to next after Avastin is largely determined by the insurance companies. There are frequently preferred lists, and we are really bound by what they want us to do. Another medication that we will inject into the eye are steroids. Intravitreal steroids. Steroids we put inside the eye come in a couple of different flavors. The one that we use most of all is one called Ozurdex, and it is dexamethasone as a pellet. We put it inside the eye. It's a little white pellet that erodes away over a period of about 6 weeks. There's also 2 other injectable ones, Iluvien and Utique. Those are a kind of a plastic tube that has medication in it that lasts much longer but has a much lower dose, so is somewhat less effective but can give a longer duration of activity. We use that one much less than the other ones. Another medication sometimes that we use inside the eye are antibiotics. We will mix them up here in clinic, and we use those for infections within the eye. Hopefully we don't have to do those very often, but sometimes you will see us administering antibiotics in the eye here in the clinic. Another kind of little bit of an outlier is injectable medicines that we actually put around the eye. And we can put steroids, namely one called Kenalog, in the space around the outside of the eye. It is not quite as effective as medication inside the eye, gives us a longer duration activity, and also is more effective than eye drops. So it's kind of a middle ground for all of those medication administration routes. That's kind of a basic group of eye medications. It is useful to remember the drops because you'll encounter them again and again. The typical scenario is that patients will not remember what medication that they're taking. Instead, they will tell you what color tops the drops have. And so being able to remember those will be very useful for you long term. Also, when patients call and they are taking some drops and maybe they were taking it after surgery, then knowing what kind of drops we use after surgery is very useful. But memorizing these will definitely pay dividends. All right, that's another step in your knowledge for what goes on around the retina center. Hopefully we can get you up to speed real quick.